Moti,
source of influencers.
Are all your patients happy with the final result?
The reason all my patients are happy is because we have an honest, transparent relationship from the minute they walk in the door. I'm always honest with people about what I can or cannot give them. I talk to people about their realistic expectations, and always do the absolute best that I can for people. So I'll answer the question in that way.
And are there any customers who have wishes that you think go too far, or?
There are a lot of people who come in and ask for things that I don't necessarily think will be appropriate for them. That happens a lot. And in which case I will tell them I can't do anything for them. So I will never let a patient get too far, but there are many instances where that potentially could happen if I didn't put the brakes on, but I'll never let that occur.
What is too far?
Too far would be doing something that didn't look natural, that didn't fit for that person's face. Maybe they want to make their lips too big, or their cheeks too big, or their face too pulled. I'll never let anything get too far. I won't do anything that I don't think looks good.
So you won't make somebody into a cat man or something, stuff like this?
I will not make somebody into the cat lady or the cat man. No, that I won't do. There are doctors who do that, and there are patients who want that, but that's not people who want that know not to come to me. They know that I don't do that.
How was your experience with Netflix?
Working with Netflix was great. It was a great experience, and I think that's a great platform to provide a documentary type series to give people information. It was really great. And managing the practice while filming for Netflix, it was like anything else. It's always a balance. You have to manage your schedule appropriately. I still have to balance my family life. I have to make sure I have enough time to go home and play with the kids. But it's a challenge, but it's always fun to do that. And it's something we've done a lot of, so we know how to do that. So it was a great experience.
And how do you combine your busy lifestyle with your life as a family man?
It's very difficult to to balance the busy lifestyle with life as a family man. I do my best. I do my very best. I try not to miss any events that the kids have, whether it be a school event or a sporting event. But as you can see, it's 9 o'clock at night on a Monday night, and I'm here at work. So there are times where I can't see the kids before they go to bed. And it always does bother me. So I do my best to give my patients 110%, and I do my best to give my family 110%. And it's hard, but it just requires, a lot of work. It requires a lot of work and a lot of effort to be able to do that, and I do the best that I can.
Is there a minimum age to do plastic surgery?
There really is no minimum age. Some kids who are born with cleft lips or cleft palates have cosmetic surgery at the age of 6 months old to repair some of those things. Classically, kids with prominent ears, we call promenoris, that's the name of that condition. That's recommended to have that fixed at the age of 5. So that they can have that fixed before they start to have problems at school where people are making fun of them, to prevent psychological issues. So those are well accepted ages to fix those problems. So there's really no minimum age. For certain procedures, there are recommended ages. For a nose, for rhinoplasty, in a standard situation, typically we say for a girl, she should be about 15. For a boy, they should be at least 16. There's no minimum age requirement for a facelift. It's, typically we start considering that for people in their 40s, but I've done some for people in their 30s when there was weight loss and they have an extra sagginess or something like that. So there is no real minimum age. It's all up to the doctor's judgment.
Follow the Moti on Instagram, Facebook, and Snapchat.